the reason why enzyme inducers, they can cause damage to people that we are treating. I think that to sort of put it on a sort of very nutshell, these drugs, they make the liver work over time. And by making the liver work over time, they actually increase the clearance of a number of other drugs, but most importantly of enzymes, endogenous enzyme systems that we need to work well. For instance, it will lead to hormonal changes that will affect bone health. And therefore, people that take these drugs in the long term, they might be at risk of osteoporosis and pathological fractures. It may affect sexual function by increasing the clearance of sexual hormones of the body, leading, for instance, in male erectile dysfunction, or and can also cause problems for women. It's well known that people that have, for instance, chemotherapy for cancer, their survival is less ideal compared to people not in enzyme inducers. So there is just some of the issues around it. And then we have probably the most important problem is that they increase the potential for cerebrovascular disease and cardiovascular disease. And therefore, they may be taking, causing comorbidities and taking years off people's life expectancy. We don't have the clear evidence, but all the sort of circumstantial evidence coming together seems to be consistent that there is a problem with this class of drugs. In favor of them is that you could argue that they are very cheap, and sometimes this is the only drug that some of the people we look after with epilepsy, particularly in resource-poor settings, will be able to afford. Now, I think that the problem with these drugs is when they have to be taken for long periods of time. So you could argue that maybe if you seeing that someone will only need a short period of treatment, a few years, you might be in a stronger wicket than if you say, I know that this patient will have to take such drugs for the rest of their life. So I think it's always a dilemma. But I myself, I know as a fact that I would not use enzyme inducers if I were to treat myself or someone in my family.